When things go south, do you call 911, the map supervisor, or the map consultant? Let's break it down. Stephanie here. I've been a nurse forever and director of health services. I'm here to help you pass the medication administration program. So I want to talk about who do you call when, because they love to ask these questions and just as you're working so you could understand. So in class, I like to say, for example, in the state of Massachusetts, it's called the Medication Administration Program. Other states could be Meditech and things like that. So let's talk. I'm talking about the framework of Massachusetts. You could see what applies. So you are a certified MAP staff. It was 20 hours online, 2 in-person days, right? So, and although I'm sure you're wonderful, I hope you understand that you do not have the scope, the expertise, the knowledge that someone like a doctor who went to school for 10 years or a pharmacist or a nurse would have, right? It just makes sense. As a certificate program, you play a very important part, which is why we need you in this role so desperately, but you have gaps. So being in a group home with residents, they're not called patients because they're in their home, but with residents, clients, whatever terminology is most appropriate, there are instances where you're going to have to reach out, Mayday, call for help, right? So in this home environment, there are different things that can happen that you would call different people. Now, all the time in a group home, there's something posted that you could see these numbers quickly. So let's go through. Let's do 911 first. Let's discuss 911 first. In healthcare, there's ABCs, airways, breathing, and circulation. Most healthcare positions, you have to be certified in CPR or basic life support and recertify every 2 years. So if you're entering the field or you are in it, I'm assuming you understand that. So airway, breathing, circulation. Anytime is one of those issues, the expectation is that you would initiate CPR and call for help. That's a 911 call, right? So that is not a MAP consultant's call. That's not a supervisor. Now, there are things that you do, and you could watch my other videos after you've called 911 because the patient is always first. You have to make sure that the patient is okay. After you've called 911 and the video is posted, I can't remember the title, you could just like and subscribe and watch the playlist on medication administration. More recent ones you'll see. There are things you do after the patient and you call all the appropriate people in the appropriate order and fill out appropriate documentation. But right now, in this moment, an airway, breathing, circulation issue, you call 911. Okay. Another scenario, for example, in our group rooms, we had a policy if anyone fell and hit their head, we would call 911. Sometimes people could be on blood thinners, but that was our policy for the group rooms that I used to supervise. So if within your agencies a fall and hit their head, you would call 911. Okay. So there's a sense of urgency about it. All right. Also, you are trained or you will be trained to take vital signs, see if they're appropriate. And if there's something called responsive, you find a person unresponsive, again, might fall into the ABC, airway, breathing, circulation, you call 911. We also had a policy that we would call for seizures, especially first-time seizures. Now, there's a difference between witnessed seizures and unwitnessed, or if somebody has a well-known seizure history and they have seizures all the time, but you call 911 for seizures, especially if they're not used to having seizures. So that is not the entire scope, but I'm just giving you example of when it's totally appropriate and expected that you would call 911. Okay, so that's easy enough. Kind of if someone gave you a scenario, you would figure out that's a 911 call. Now, another scenario is calling the MAP consultant. So when I worked for the group home, I was director of health services and I had the phone and I served as a MAP consultant. So I like to differentiate between the MAP consultant and a MAP certified supervisor. I was not the supervisor of the group home. I was the MAP consultant. The MAP consultant comes in when you need clinical judgment. Does that make sense? And I have a video about the MAP consultants, who can be a MAP consultant. So I'm an RN, a registered nurse. I qualified to be a MAP consultant. Watch that video to see who else qualifies. So the MAP consultant, you come in with clinical judgment. I've been a nurse for a while. So say a MAP staff and someone says they gave medication and the person's saying that they're nauseous. Okay. So what do you do for nausea? You're not a doctor. You can't just prescribe something for nausea. You can't just send them to 911. It's not quite a 911 call. So clinical judgment would be a MAP consultant. So that's a perfect example of a MAP consultant. So you would call me and I could say, did they throw up? Because nausea is different from actually having an episode of emesis, which is vomiting. How did they throw up the medication? Does this happen all the time? At this time, we could troubleshoot. I want you tomorrow. It's not quite an emergency room visit. Call, book a doctor's visit for tomorrow morning. Like we could work through it clinically so that I could support you in the role to support the patient. All right. Does that make sense? Now, a certified MAP supervisor is I have a video about suspicious activity. You go to give meds and you're able to give the med, but the count book was off. Do not call me the MAP consultant, right? That has to do with how the house is being ran or what's going on. So the patient's safe because the patient got the med, but now you got to take care of whether it's a suspicious activity or non-suspicious, or whether it was documented incorrectly. That's a supervisor you're going to call. The supervisor has protocols to manage the house. Does that make sense? Do you see how that's different from the nausea or the 911 example? The supervisor is managing the house, whether there's funds to go out, whether a staff didn't come in, whether the count is off, all of those things to make sure the house runs smoothly and that residents are well taken care of. Okay. So you have 911 MAP consultant and MAP certified supervisor. All right, so I hope that is helpful. You can check out our playlist. You can click the link. I love a like and subscribe, and we have some practice questions if you want some more assistance. Check the links below. Bye.